Hello, my name's Dr. Amanda Riley. I'm a GP in Darlington and I'm the Clinical Director of the Darlington Primary Care Network. I'm going to spend just a couple of minutes talking to you about COVID-19 and what you can do to keep yourself, your family and our community safe. The virus is much more dangerous if you are vulnerable. That means older people, people with underlying health conditions such as obesity, heart disease, diabetes or lung disease, and people from Black and Asian ethnic minority groups are also at an increased risk. The number of cases in Darlington is currently rising. It's really important that we all follow the government guidance and remember hands, face, space. Wear a mask in enclosed public spaces like shops. Keep your distance at all times. That means 2 meters away from anyone outside of your household. Don't meet anybody from outside of your household or bubble inside. Wash your hands regularly for at least 20 seconds and avoid touching your face. Remember the rule of 6. Don't meet up with more than 6 people, even outside. Self-isolation is incredibly important. Anybody with symptoms that could be COVID-19 needs to self-isolate. This includes a new persistent cough, a temperature of 37.8 degrees or higher, or a loss of taste or smell. If you develop these symptoms, you should stay at home and self-isolate. Arrange to have a COVID-19 test by calling 119 or going online. The result of the test will determine how long you must stay at home and self-isolate for. Self-isolation means staying at home and not going out for anything. You shouldn't go shopping, you shouldn't go to school, you shouldn't go to work. Stay at home whilst you're waiting for the home test kit or a test site appointment and until you receive your result. If your test is negative, you can stop self-isolating so long as you're well. A positive result means you must complete a 10-day self-isolation period from the start of your symptoms. Your household members should isolate for a full 14 days. A negative test within that period does not mean that they can cut that short. Whilst you have symptoms, stay as far away from other members of your household as possible, especially if they're vulnerable. Avoid using shared spaces like kitchens and take your meals to your room to eat. You could be fined if you don't stay at home and self-isolate following a positive test result, or if you're notified by NHS Test and Trace that you need to self-isolate. Health services are really struggling already under significant pressures as we head into winter. We're doing our very best to meet the needs of our patients through this really difficult time. For those of you that are able to access it, 111 online has a wealth of information that may help you manage some simple health conditions at home. If you don't have access to the internet or for non-emergency appointments, please call 111 or your GP surgery before turning up at A&E or the doctors, so that we can direct you to the service that will best meet your needs at the time. Please be assured if you do need to be seen face-to-face, we can arrange for this to be done safely. Please don't ignore serious symptoms such as chest pain. The NHS is there to help you. Call 999 if it's an emergency. Please look after yourself and others. We will get through this together. Thank you for listening.